So I'll go ahead and get right into this. The client is a 62-year-old male who is an employee here at the University of Mount Olive. He is relatively physically fit. He participates in CrossFit, stuff like that. But he is hypertensive because he's on medications for that as well as dyslipidemia. And he was also diagnosed with type 2 diabetes roughly 10 years ago in 2010. He's on medication for that as well. Um, Other injuries to report are he had shoulder surgery, surgery on both hands because of carpal tunnel, and had knee surgery, so he has pain in his knee. Just had to take those into account for prescribing exercise. So just some things about diabetes are important for this client is that in order to exercise, you have to be in control and know how to manage your blood sugar levels during your workout. If not, that could be very detrimental to your health. You could go into shock, things like that, if your blood sugar gets too low. So you have to be able to control it. Have to be on a tight schedule with your medication. Take it the same times every day. It's important to eat right as well, along with taking medications so that you can control your blood sugar in that way. Um, some other things. Inactivity isn't good for diabetes. Inactivity could result in becoming obese and developing diabetes, and those two things together increase CAD risk factors. As well, inactivity could result in increased resistance in insulin and a poor glycemic control. So those are just some things to watch for and ways that physical inactivity could affect diabetes. And then we'll get into the prescription piece prescribed for this client. So some exercises that we chose to work with. Obviously every day he has his warm up and cool down. So 5 minutes of transitional exercises. This could include flexibility if he wanted to. This client usually likes to keep his workouts between 30 to 45 minutes, which was a little tough, but we managed to do what we could. So obviously every day that he's going to work out, he's going to have to warm up under 40% intensity, so roughly around 102 beats per minute. He should focus on things like stretching, getting his blood going to the areas that are going to be worked that day. And then on Mondays, he has the stair climber. This was just a really good way to burn a little bit more calories than walking on a treadmill. He's got 20 minutes, and then he has beginner yoga. So he said that he mentioned in his interview that he wanted to try yoga, so put that in his prescription on 2 days a week, which also helps with neuromuscular function. And then for another type of cardio, we chose rowing. Rowing is just a really good way. It's a good full body cardio because you're using your legs and your arms and your upper body. I just felt that was a good way to keep him moving and kind of get away from the normal prescription of walk on the treadmill or sit on a stationary bike for however long. So just figured we'd get in on the other aspects of cardio and using the rowing machine to our advantage. And also for muscular strength, the way we did it was upper body one day, lower body the next, and then full body to finish the week off. So for some upper body movements, obviously with his shoulder injury and wrist, probably going to have to stay away from bench press and push-ups, as he mentioned. But he could definitely bench, as he said, with lower weights, so he could do that if he wanted. Some exercises he could try were, focus on, for chest anyways, he could do things like dumbbell chest press, kind of work on his wrist strength, or he could even do lightweight kettlebell chest press with the weight up, work on that stability in his wrists. Some other upper body movements he could do are, your basic bicep curls, things of that nature. kind of avoid overhead presses, especially with that shoulder surgery. And then for lower body, with that knee pain, maybe goblet squats instead of back squats, and take a little bit of the load off the nervous system, and then also goblet box squats so that he's not putting a ton of stress on that knee joint. He could also do things like the adductor and abductor machine, so he's getting in that lower body work without putting, again, too much strain on that knee joint. But some things he could do to help that out are when he stretches on his lower body day, focus on stretches that are going to improve that range of motion in his knee and hopefully get rid of some of that pain in that area. And then on his full body day, figured that we keep this more up tempo and go with like a HIIT style full body workout where he could do things like curl squat press. I know he said he hates them in his interview, but burpees would be a good one to do on this day, kind of keep it up tempo. As he said, he likes HIIT workouts, so that would be a type of workout that he could do on his full body days, stuff like that. And then obviously one day a week, we have him golfing, as he said that he really likes to get out and golf as much as he can. So we encourage him to walk on those days, just to get in some extra calories. But if he needs to use the cart, obviously he can. And thanks for the great semester, and we'll finish things up.